Hopefully that'll work. Good afternoon, everybody. I had a little slight technical glitch, so my apologies. Hopefully we'll be able to navigate through this session without any issue. Welcome back, or welcome for those of you that are brand new to our Diabetes University program. Again, this is a monthly venture where each month we will discuss a new issue as it relates to diabetes self-management, and we'll be publishing information on our webpage about future classes. And if you got the invite to this particular session, you're already on our mailing list moving forward. So every month, the third Thursday of the month, you can save this date, and hopefully we'll have information that might appeal to you as it relates to diabetes self-management. So far, we've covered nutrition, we've talked about mental health, but this month, we're going to learn about diabetes medication, which in and of itself can be a pretty intimidating part of the diabetes self-care process. So we're fortunate enough to be joined by Rachel Carloni, who's going to go through some information about diabetes medication, but also want to give you an opportunity to ask questions along the way. And I also have some more information to share with you individuals on Gator Care as it relates to some of the test strips. So Rachel, I'll turn it over to you.
Okay. All right, thanks, John. So today what we're going to talk about is some of our standard diabetes treatment options. So a little bit of some older meds, and then touch on some of the newer medications that have been approved recently. Like John said, if you guys have questions, feel free to just either unmute and ask as we go, or just throw the question into the chat box. If I don't see it, I'll make sure to address them at the end. All right, so starting off, just like an overview of some diabetes treatments. So a lot of patients with diabetes, especially early on, can control their blood glucose levels with either a combination of diet or exercise alone, but a lot of patients will eventually require medications to help decrease or reduce blood glucose levels. What we're going to talk about today is mainly treatment of type 2 diabetes. Treatment of type 1 is a little bit different. It mainly just includes insulin, which we will talk about, but just keep in mind as we go through this, we're mainly discussing treatment of type 2 diabetes. Another big thing to remember is that there's a lot of different medication regimens for diabetic patients. So I'm sure if I asked 5 people what their regimen was, you'd probably have 5 different answers. And usually that's based off a lot of different factors. So one thing could just be a patient's A1C when they are diagnosed or at a specific time, as well as diet, how often do they eat, any allergies to any medications we of course want to keep in mind, and then of course preferences. So if patients say, I don't like taking oral medications, I'd rather take something injectable, that's an option as well. So never be alarmed if what you're taking is different than what your friend, family member, spouse is taking. It's going to be different for everyone. And then, like I'm sure you guys have discussed before with John, all of these meds are going to be most effective and need to be used in combination with a healthy diet, regular exercise, and then any reduction in weight for someone that requires it. All right, so treatment goals. So our main goals here are obviously to reduce blood glucose levels in the short term, as well as prevent long-term complications of diabetes. So things such as stroke, heart attacks, progression of kidney disease, neuropathy, etc., as well as reduce cardiovascular risk factors. So there's a few different ways that all of these medications work, and I'll just kind of lump them into general ways. So medications that we're going to talk about can work by helping to increase the amount of insulin within your body. So anytime you increase the amount of insulin, it helps to decrease blood glucose levels. We can also make your body respond to insulin better. So this increases the sensitivity, usually of muscles, to pick up insulin and therefore glucose. We can also take medications that delay how fast food and mainly carbohydrates are absorbed through your GI tract. By slowing down that absorption, we can help kind of to get a more sustained release of glucose after we eat a meal or a snack and it helps kind of maintain stable glucose levels. And then our newest class of diabetes drugs is this fourth way that the medications work, and they actually increase how much glucose we urinate within the urinary tract. So just a new way of getting rid of extra glucose in the body. So we're going to start with oral diabetes medications. So you can see here the list of meds we're going to talk about. So metformin, some older options such as sulfonylurea or TZDs, DPP-4 inhibitors, which are drugs like Januvia, SGLT2 inhibitors, drugs like Farxiga or Invokana, and then our newest class of diabetes medications are GLP-1 agonists, which is Ribessus. All right, so we're going to start off with metformin. Hopefully most people have heard of metformin. It is a pretty old drug in terms of how long we've had medications for. I believe it was released or approved in 1963, so we've definitely had it for a while. And metformin is a great drug, and it's really the standard of care for patients with type 2 diabetes, and even sometimes used in patients that have type 1 diabetes. The way that metformin works is it works by decreasing how much glucose is released from our liver. So our liver is automatically always releasing a small amount of glucose, which most patients don't need. So this drug works just by kind of turning off that glucose production within the liver, and then also helps to improve how sensitive our muscles are to glucose. So it works in two different ways. There's a bunch of different formulations of metformin. So it's available either as an immediate release medication, usually used once or twice a day, or an extended release medication. So the extended release is nice because it can be taken less often, but it also can cause less GI side effects. So if anyone's ever taken metformin, I think it's usually the main complaint or concern that patients have with metformin, just causes a lot of GI upset. Things like nausea, vomiting, potentially some diarrhea. The good news is it can cause weight loss, usually because people do have somewhat of an upset stomach, but can be around 5 to 10 pounds for some patients, so a pretty good amount of weight loss. And one beneficial side effect is it can actually lead to improvements in cholesterol levels. So whenever you get cholesterol checked, we look at LDL as well as HDL. LDL is the quote unquote bad cholesterol, and HDL is good cholesterol, so it can help improve HDL levels. So beneficial just outside of diabetes as well. All right, big things to remember if you are taking metformin. First of all, we'll skip actually to this last bullet point here. Metformin is the preferred first-line medication for all patients with type 2 diabetes. So unless there is a reason why a patient cannot tolerate metformin, we do recommend that all patients take it. So some people that say they can't handle the side effects, or if you do have decreased renal function, those would be the main problems why you wouldn't take metformin. But we do recommend that all patients with type 2 diabetes be on metformin. Other big things to remember, this is the drug that has been proven to have the most long-term benefits for patients with type 2 diabetes. It is a pretty safe medication. The side effects are pretty limited. And most patients within a few weeks of starting the medication will see resolution of the side effects. One big thing to remember is that if you are getting any test done that requires IV dye, such as a CT scan, just let your physician or whoever is doing the test know, because they might have you just hold off on taking the medication for a day or two. And then probably one of the more important points is this second to last one here. Metformin is a very cheap drug. So if you are on it, even if you don't have insurance, or if you do have insurance, you can get it free at some pharmacies. I know Publix is giving it away for free. I'm not sure if it's free anywhere else, but any pharmacy that has a $4 list, I think like Walmart, maybe Winn-Dixie, they usually will have metformin for $4, or like I said, for free. So nice way to save, it's a few dollars at least. All right, so moving on, we won't spend too much time on this class of medications because they are older drugs that we don't see a ton of now. And they are a class of drugs called sulfonylureas. And these drugs work by helping your pancreas to release more insulin. Like I said before, anytime we have more insulin in the body, we help to decrease blood glucose levels just because it's helping to use some of the glucose that's circulating. So all of these, like metformin, are available as generics. I put the three that we most commonly see in bold, and then there are old brand names behind it. So glipizide, glimepiride, and gliburide. They're pretty interchangeable in terms of what they do. So very similar medications, usually given once to twice a day, kind of depending on how much someone eats and their glucose levels. So side effects, big thing here is hypoglycemia or low blood glucose, especially if you don't eat. So remember, they help to release more insulin. Anytime you have more insulin in the body, main side effect could be hypoglycemia or low glucose levels. Some people have a little bit of weight gain with these medications, usually pretty minor, but just something to be aware of. And then big things to remember, take these drugs at the same time every day, usually right before you eat. If you're someone that isn't gonna eat or you don't eat regularly, probably not the best option for you because you would be more predisposed to that low blood glucose. All right, so we'll move on to another class of drugs that are actually not super old, but kind of not used very often. These are drugs called TZDs. It's a abbreviation for that really long word up at the top of the screen that I won't expect you guys to be able to pronounce. But these are drugs that work by increasing how sensitive the muscles in our body are to insulin. So it just helps our body to respond to insulin a little bit better. It also helps to decrease glucose production in the body, mainly from the liver. So the two most well-known, or the two drugs in this class, are Actos and Avandia. Their generics are pioglitazone and rosiglitazone. And really, we don't see these used a whole lot anymore. If we would see one, it would be a drug. It would be pioglitazone or Actos, the first one listed. The main reason that we don't see Avandia used is usually due to, unfortunately, some long-term cardiovascular side effects that happened. If you're someone that watches the nightly news, you've probably seen one of those like class action lawsuits about Avandia because it was associated with some long-term cardiac side effects. So usually we don't use that anymore. If you are on Actos, big side effects to remember: weight gain, strangely enough, upper respiratory tract infection, headache, and then increased risk of heart failure or bladder cancer. Those are pretty rare, but those two are mainly why we don't use these drugs anymore. And we're done with this group of drugs, but I just want to touch on a question to the group. It was a question about the side effects of metformin, how long they last, and if there's anything that you can take. So the side effects with metformin are very common. I think a lot of people, probably the majority of patients that start metformin do experience them. Usually they experience these side effects for about 2 or 3 weeks after starting it, or anytime the dose is increased, but everyone's different. So if it is something that's happening longer, we usually tell patients to talk to their doctor. You could switch to the extended release formulation. And if that's the case, it does decrease how often you have to take it, but also the prevalence of side effects. And that drug can also be taken right before bedtime, so that patients that do have some of the upset stomach or GI problems usually just kind of sleep through the problems. And then the question was also, is it common to have issues with gas? Extremely common. Metformin is not the easiest drug to start, and really, we wouldn't probably push it on people as much if their benefit wasn't as profound as it is. So we do ask patients, try to keep taking it as long as possible. things like Tums, Zantac, any of those over-the-counter, upset stomach, kind of like heartburn medications can help with some of the side effects, or just decreasing how fast you increase the dose. So that could also help as well, but you could also try switching to the extended release. So hopefully that helps. If there's more questions, of course, just throw them in the chat box. I'm more than happy to answer them. All right, so moving on from TZDs. Like I said, not used very often, mainly due to side effects and like long-term cardiovascular things. So unless you're like watching the nightly news and see those commercials, you're probably not going to be on one of these drugs. All right, so we're going to move into the last 3 classes of oral meds. And these are all definitely the newest drugs that you'll see on the market. Unfortunately, the next 3 classes are also all brand only, so they're the most expensive. But definitely the most commonly, starting to be the most commonly prescribed. So you'll see them more and more. And if anyone, like I said, has questions as I go, for sure, just throw them in the chat box and I'd be more than happy to answer. So we're going to start with a class of medications called DPP-4 inhibitors. And I think it helps to know what these are. So Januvia is probably the most commonly known of these medications. We also have Onglyza, Tradjenta, and the newest is Messina. I put all of the generic names in unbolded font in front of them as well, but they are all brands still. And the way these drugs work is they increase the release of insulin from the pancreas, as well as slow how fast food moves through the GI tract. So anytime you're slowing how fast food or gastric contents move, you're helping to kind of create a more sustained release of glucose instead of that really high spike of glucose that you'll get right after a meal. It also can help patients feel fuller longer after they eat a snack or a meal. And a lot of patients will say that they lose weight because they're just not eating as much. They feel full longer than they used to. So as I said, we do have 4 options here. They do, since they are newer drugs, they're somewhat expensive. The best thing to do is to figure out which one is covered by your insurance. I know if you are a Gator Care member, you can go to the website and look up any of these meds to see if it's covered. And then a big thing that I always advocate for is anytime you're started on a medication, especially if it's a new medication that is brand name only, just Google the name of the drug and the word coupon. And you can almost always find a drug manufacturer's coupon that will help to take care of some of your copay. I believe it is Onglyza has a coupon that I think takes your copay to around $5 a month. So the drug company will actually pay up to, usually there's a limit every month, but they'll help pay some of that copay. A good thing about these drugs is that they're really well tolerated. So I know we've talked about a few medications. We talked about metformin. We talked about TZDs. So we've talked about drugs before that really aren't well tolerated. With these medications, the side effects were pretty non-specific. So some patients had headaches, upper respiratory tract infections, but pretty like limited side effects. So super well tolerated, especially compared to something like metformin. And things to remember, like I said, still pretty expensive. Figure out which one is covered by your insurance and try to use those copay cards. It's money that the drug manufacturer is giving you for free. So anything that's brand, go ahead and just Google it, unless you want to spend more, but they'll pay for a good amount of them. All right, so moving on, we're going to talk about the second newest class of oral medications, and these are called SGLT2 inhibitors. This was kind of an exciting thing that happened when these were released, because for years and years, we didn't have medications that worked differently for diabetes. We only had ways of helping to manage what glucose was in the body. These drugs actually help by getting rid of extra glucose. So usually your kidneys don't excrete glucose until your serum glucose levels are around 200 to 250. These drugs actually work by decreasing that threshold. So they help to excrete extra glucose that you don't need in the urine. So just another way to get rid of extra glucose. So kind of exciting. You probably have also heard a lot about these drugs for other reasons that we'll talk about in a minute. But these are all brand still. So Jardiance was the first one, followed by Invokana and then Farxiga. Relatively interchangeable. Some of them might have more benefits, which we'll talk about as well. But definitely like drugs that are very popular right now in medicine. Like I said before, if you watch the nightly news, really popular commercials right now. I think it's like the Jardiance one, everyone's dancing around, very happy in the drug commercial. So really pushing these drugs on patients, and they do have a lot of benefits. Before we talk about the benefits, I do want to talk about the side effects. And if you ever see those commercials, they'll list like 15 side effects really fast. But these drugs are associated with a little more side effects than some of your standard medications. So they are associated with increased risk of urinary tract or genital infections. And that is mainly just due to the increased amount of glucose that's being excreted. Glucose is of course food for humans as well as bacteria. So when you have that extra glucose being lost, it's just essentially like a way for bacteria to breed. So someone predisposed to UTIs or a history of genital infections, probably not the best option. Because they do also cause increased urination, hypotension can be a potential side effect. We do tell patients if you're on one of these meds, especially in a place like Florida where it's already hot, make sure you're drinking plenty of water and staying hydrated. One good side effect is they can cause relatively significant weight loss, up to about 15 pounds in some patients. So definitely like a good amount of weight loss, anywhere from, of course, 5 to 15, but pretty significant. Some of these medications, especially Jardiance, has been associated with decreased bone mineral density. Anytime you have decreased bone mineral density, that's going to predispose you to something like osteoporosis or having increased risk of fractures. If you're someone that already does have this, definitely make sure that you discuss it with your physician, and you're taking any supplements like calcium or vitamin D that you may need to take. And then kind of the three most severe of all of these side effects is the last three that are listed. So Invokana in particular has been associated with an increased risk of lower limb amputations. It's not really known exactly why this happens. We do know that, of course, diabetic patients are at an increased risk, usually due to poor blood flow and potential increased infections. But it was even more profound in patients that took Invokana. So if you are someone that has had a history of an amputation, you've had lower extremity infections that were pretty severe before, just make sure that your physician's aware, because it might be more beneficial to switch to another agent. In addition to that, Invokana and Farxiga have both been associated with kidney damage. Usually acute kidney damage that resolves, but once again, like we said, make sure patients are staying hydrated while they take this, but definitely something to be aware of. And then last but not least, they have been shown to increase the risk of what's called diabetic ketoacidosis. Usually this is very high levels of glucose within the body, as well as buildup of acids. So definitely kind of a medical emergency. If you are a patient that has a history of diabetic ketoacidosis or DKA, this probably wouldn't be the best option for you, but usually in most patients is otherwise safe. And then moving on to the good news about these drugs, and this is really like a very popular topic right now, both in treatment of diabetes as well as treatment of heart failure. These are the only class of diabetes drugs that, in addition to lowering glucose levels, have actually been shown to improve cardiovascular outcomes. So a lot of the other drugs, or all the other drugs that we have, we know they decrease glucose levels, but we don't actually know, do they have long-term benefits in helping to prevent things such as heart attacks, stroke, heart failure, And these drugs have actually been proven to reduce the incidence as well as time to all of those cardiovascular events. The other cool thing is that they can be used in patients that don't even have diabetes, but have heart failure, and they help to kind of prevent how fast heart failure progresses, as well as death from heart failure or even incidents of hospitalization. So very cool drugs. I know we talked about a lot of side effects, but for a lot of patients, the benefit of these drugs and helping to prevent cardiovascular events outweighs those side effects. So if you do have, a family history of cardiovascular side events, or if you have a family or a personal history of cardiovascular events, I think it'd be worthwhile to at least ask your physician, do you think this is a drug that could help me? Most of the benefits are associated with jardiance when they've gone back and looked at the studies. So just keep that in mind. And as I said before, a lot of side effects, so just be sure that the benefits outweigh the risks. So definitely a good conversation to have with your physician, just to make sure that it's the right drug for you. But really like a very cool class of medications that we're seeing used more and more because they are so beneficial. Like I said before, all of them are brands. So once again, look for copay savings cards. Just Google the name of the drug and the word coupon, and you should be able to find one, I believe, for all three of them that make your copay around $5 or $10 a month. And then last but not least, this is the newest class of oral medications, and these are drugs called GLP-1 agonists. So these are drugs that we've actually had in an injectable form probably for about 13 to 15 years for now, and they're really great drugs. They work really well, but most patients, I guess I can't really take a poll, but most patients do not really want to take something injectable. I think it's usually the exception to the rule that people prefer injections over oral medication. So they weren't as probably widely used as they could be. So recently the drug company came out and made an oral formulation of GLP-1 agonists, and this is called semaglutide. If you've ever heard of the injectable form, it's called Onglyza. And the brand name of the oral medication is Rybelsus. So we'll talk a little bit more about the injectables in a minute, but main side effects are, once again, GI upset. They do sometimes cause a good amount of weight loss. For patients, I did have a patient once that said he lost about 15 pounds with these. So good for patients that might need to lose weight, but they are associated with things like upset stomach, indigestion, etc. And then a big warning for patients that have a history of thyroid cancer or high risk of thyroid cancer, probably not the best option, just because it can lead to development of thyroid cancer, but pretty rare. All right, so that's it for oral medications. We're going to talk briefly about injectables. Whenever I would teach this class in the past in person, we would actually test out injecting pretend insulin, but you guys are lucky that you're on Zoom, so you don't have to do that. But we'll go back to the GLP-1 agonists. So we're now talking about the injectable formulation that we were just talking about, the oral medication. And the way these drugs work is, once again, slowing gastric emptying and also enhancing insulin release within the body. So they're pretty good at, like I said before, causing weight loss. Once again, patients say feel fuller longer, up to about 15 pounds of weight loss, and more controlled glucose levels as well. So there's a bunch of different formulations. The first one that was approved was Byetta. And then after that, they made Bydureon, same drug. The benefit is that Bydureon is only once a week. We also then have Victoza and Trulicity and Ozempic are probably the three that are used most often. Excuse me, before I think I said that semaglutide was something different, but it's Ozempic and then the oral Rybelsus. I think Ozempic is probably the most commonly used of all of these drugs now. once again weekly, so really easy for patients to administer just once a week, usually the same time every week. And once again, all of them are brands, but you can get copay savings cards that will take the cost down pretty significantly. So side effects, which we kind of talked about, GI upset. If you want to look on the positive side, it can sometimes cause weight loss. There is a slight risk of pancreatitis with these medications. We know that diabetic patients are already a little bit predisposed to pancreatitis, so this just can add on to that risk. So if you are someone that has had pancreatitis, probably not the best option, and just be aware of the risk. As well, like I said before, of thyroid cancer, especially in patients that have a personal history or a family history of thyroid cancer. But pretty cool drugs, especially since they can just be once weekly. So good for patients that maybe can't remember to take a tablet once, twice, 3 times a day. So yeah, as I said before, great alternative for people that can't take something every day. Remember that we now have an oral medication, so same benefits, just not injectable. And once again, somewhat expensive to use those copay savings cards. And then last but not least, we'll talk about insulin. We're not going to talk too much about insulin because this is a whole hour or more within itself. But I think the big things to remember about insulin is that a lot of patients that have type 2 diabetes are eventually going to require insulin. And there's even some patients that prefer to start treatment with insulin. I think that it should be kept in mind that requiring insulin is not by any stretch of the imagination a failure. It's usually just natural progression of the disease. And it is most similarly related to what should be happening in the body. Of course, it does require injections, but insulin needles are tiny now. They really are not super painful, and most patients that are on insulin do very well with it, and it has very limited side effects. Usually the side effects with insulin would be too much of a dose compared to what's being eaten. So usually very well tolerated, besides like injection sites, a little bit of pain, or maybe just discomfort. So ideally an insulin regimen includes at least one type of insulin. So we'll use something long acting, such as Levemir or Lantus. Those are the 2 most commonly known long acting insulins that are usually given once daily, as well as mealtime coverage with something like Novolog or Humalog that is rapid acting, that just takes care of that glucose that's released during the meal. Other types of insulin you might have heard of, NPH, 70/30, or regular insulin. These are older, they work great, but sometimes they just require a few more injections, so we don't sometimes use them as much anymore. But if anyone here has like a pet that has diabetes, usually you'll be buying regular insulin. You can just buy it over the counter, actually. You just have to go ask for it in the pharmacy. And yes, someone just asked if you can see the slides after. John will definitely be sending them out. So other things you might see, like I said, insulin's a whole hour plus within itself, but you might sometimes see new concentrated insulins, such as like U200 or 300. The benefit of those is it's the same dose, just a smaller volume, so it doesn't, you don't feel it as much when it's being injected. So kind of just a new thing that's being studied in diabetes, but as long as you're on a good insulin regimen, it doesn't really matter which one you're on. And then a cool thing is that we're finally starting to get some generic insulin products. I think the main one that's known is called Basaglar. Pretty much same safety, efficacy, side effects, but much lower cost. I think one big thing you always hear about diabetes treatment, especially insulin in the news, is how expensive it is. So something like Levemir or Lantus, like one vial without insurance can cost $300 to $400, I believe. These new drugs, I mean, still fairly expensive, but much cheaper. So we're starting to get there. Unfortunately, insulin is a very expensive medication, and it's not really something that anyone's electing to take. So we're hoping to eventually like get to the point where we have cheap insulin options. But our cheapest ones right now are gonna be like NPH, regular, as well as 70/30. If you don't have insurance, you can actually get all three of them at Walmart pharmacies for around $24 a vial. So probably the best option for someone that has no funding at all. And then real quick, emerging therapies. These are the two most promising options right now in development for diabetes treatment. The first one that we're going to talk about, teplizumab, is an injectable medication. It actually isn't for type 2 diabetes, but I think it's kind of cool, so I wanted to include it. It is to help prevent the development of type 1 diabetes in patients that are high risk. So type 1 diabetes usually is something that is carried in families, parents, siblings, so on and so forth. So patients that do have that strong family history, this can be a medication that has been shown to prevent the onset. And it has been shown to delay by up to 3 years. So very cool, especially for some of our younger patients that are diagnosed pretty early on in adolescence or childhood. It can help push that back a few years. And then if you are someone on insulin, hopefully the second bullet point is something that's fairly interesting to you. This is called icodec insulin. And instead of having to inject long-acting insulin once or twice a day, this would just be a once weekly insulin injection. So it's in trial. There has been some data published about it. Super cool, and seems pretty effective. I think both of these medications, the FDA should weigh on probably about mid-2021. So we'll have to see what they decide, but both pretty interesting options and nice to finally see some like real development in diabetes treatment. And then real fast, these aren't medications specifically for diabetes, but they are drugs I just want to talk about. So hopefully commonly known medications to most people, but we're going to start with aspirin. So aspirin, antiplatelet medication that we know helps to decrease cardiovascular risks such as heart attacks, strokes, in certain high-risk patient populations. So a lot of patients should be taking a daily aspirin, usually just like the 81 milligrams or the baby aspirin, but make sure that your doctor is okay with it. There are some people that are at increased risk of bleeding, history of GI bleeds, things like that, but most people will benefit from taking a daily aspirin. Statins, these are medications for high cholesterol, and the way that they work is they help to decrease LDL or bad cholesterol and increase HDL or good cholesterol. A lot of patients with diabetes are at an increased risk of cardiovascular events, so they can help to decrease that risk. And then last but not least, ACE inhibitors are ARBs. These are high blood pressure medications, but they've been shown in patients that have diabetes to help kind of slow or even prevent the development of kidney problems or kidney damage. So a lot of patients, if your blood pressure can tolerate it, these are great drugs to be on as well because they can help slow the damage that increased glucose does to your kidneys. Okay, and then take-home points. Like I said, John's going to send out these slides to everyone. If you guys do have questions that you don't want to ask or you think of later, or something not related to diabetes, my email's up here. Feel free to email whenever you want. That's what I'm here for. And if I don't know the answer, I can definitely hook you up with someone that does. I, of course, am associated with Gator Care, so that's what I can speak to the most. But anytime you're started on a new medication, if you go to gatorcare.org, there's a pharmacy tab. You can click on that and then use the formulary tab. You can type in the name of any medication, whether it's covered or not, and it will tell you what tier it's covered at, if there's any prior authorization requirements, things like that. And of course, use those copay assistance cards that do help to cover some of your copay, even if your insurance will cover. And besides that, I think that's it. If you guys have any questions, throw them in the chat box. We just got one about taking some supplements, specifically fenugreek, while taking diabetes medications. I do not believe it is contraindicated to take that medication. I would have to look at specifically what diabetes medications you're taking it in combination with. But a big thing for a lot of those over-the-counter supplements or natural products to keep in mind is that they're not really regulated by the FDA. They don't really have to show that they're held to any standard. So I would make sure you're trying to purchase a reputable brand. If you go to like CVS or Target, the USP brands, it's in a brown bottle with a blue, or excuse me, an orange yellow label is probably one of the better brands to take. But anytime you're going to start taking a supplement or over-the-counter vitamin, I would just ask the pharmacist where you're purchasing it at. Does this have any interactions with any of my other medications? So yeah, I think fenugreek, I'm fairly certain, is completely safe to take with diabetes meds. But if you want to just send me an email with what specifically you're taking, I can definitely look at that for you.
All right, well, thank you very much, Rachel. Any other questions that come in, just type them in the chat. I wanted to take a moment and also refer you to that Gator Care website that's on your screen, because at that same website, if you go under programs for diabetes, you'll see a benefit that's available to Gator Care members to get the cost of your test strips covered at 100%. So Gator Care has an arrangement with Contour. So Contour is a very popular blood glucose meter, but they will cover the cost of those test strips at 100%. But there are a few aspects of the program that include watching a webinar and then filling out a form to get that benefit active. So it's more than just showing up to your pharmacy with a prescription. You've got to watch the webinar first, and then have your physician write a prescription for those specific test strips. So if you go to gatorcare.org under programs for diabetes, you'll see all the details regarding that Contour test strip program, and also you'll see details on how to get the Contour Next meter as well. There's an 800 number you can call, and they will send you the meter too at no charge. So these are some things that are helpful for individuals who are on multiple medications and have been advised to check blood glucose on a regular basis. So we want to make sure that we're improving access to be able to do that with no additional copay. So looks like all the questions have come in. So again, thank you, Rachel, for coming down here in Wellness and sharing some good information. Everybody that's on the listserv for Diabetes University, we will send out all the slides, and then there will also be a real brief post test that we use just to track for attendance credit. Nothing that you need to sweat about. It's going to be open book, but this way we can kind of track who's actually participating. So look for that. If you happen to be on this call and you're not on the email list and you kind of stumbled in there, you can also find the details to join that mailing list on our employee wellness website, or you can reach out to any one of us. So again, thank you very much, Rachel, for helping us out, and thank all of you, and have a good rest of your day. Thanks.